lost my balance, had a real hard time standing up. And then the last day of work, I got off the little minibus and could barely get to my car, and called my wife and told her, and I iced it and heated it in my knee because I thought it was my knee. And then I collapsed in the bathroom and totally lost it. There was nothing there. So we started seeing doctors locally, and they poked me full of holes and electrocuted me and took x-rays from top to bottom, even my brain. And they came up with nothing. Surgeon at Marshfield, Wisconsin, told me that he would not operate on my lower back because this was dead. Until you can find out what's causing that, and it's not your back, we're not gonna operate. So here we are, dead in the water. So we get back, and I was talking to my wife about it, so we called the doctor and said, well, at least we should do something. So we started therapy. And I was laying in bed one morning when I seen Dr. Kim on TV. And like I just told him a minute ago, he sounded sincere. Very arrogant fella. Anyway, we seen him. The first thing he said, did they look at your upper back? He said, no. He says, well, you gotta have a scan of your neck. Well, that took 2 weeks. And we come back and he looked at it, so I gotta have an MRI. So that took another couple weeks. And then he finally decided that he needed to operate, that was causing a problem. He operated, and it was hell. I got pneumonia, and I ended up in rehab for a couple weeks, doing therapy every day and walking, and it started coming back. And then I got out of there and went home, and I started exercising, doing the therapy every 3 times a week. And I'm walking and I'm doing pretty good. I got a stabilizer for a while yet. My balance is still not real good, but it's a lot better. And it seems like some days it's better than others. But thanks to the doctor, I was dead in the water and now I'm walking. Hopefully I'll start playing golf again this year. I'm having pain in my neck because of wearing the brace. You can't move, and you stay like that for a while, and then when he told me I could take it off. So if I've been really far over like this and I'm watching a squirrel on a tree over there for a few minutes and I come back, it gets pretty sore. So I don't have that full range back yet. And then also sleeping. If I get too many pillows and get my neck just not right. And it's just, I'm convinced that it's just the muscles. That's the type of soreness that it is. Other than that, voila. This is my wife, Shelley. She's my nurse. I've never made it without her.
He was basically helpless. And basically paralyzed, and if he hadn't met up with Dr. Kim, he probably would have been in a nursing home right now. I mean, it was beyond my capability to get him on his feet. I could help get him around, but for him to stay at home would have been impossible if this hadn't been resolved. So once we saw Dr. Kim, and he said, has anybody checked your cervical or thoracic spine? We said, well, that's a new terminology. No, nobody has. He said, well, that's where we'll start. So you were laid up for a number of months, and of course we're a little impatient, and it doesn't happen overnight, but the results are good, and he's walking taller and straighter than I've ever seen him in the past 5 years. He still has pain, but not constant pain. He had low-grade headaches every day, and I think those are subsiding. He's a lot more willing to get out and do things. I mean, yeah, the quality of life has really improved. Oh yeah, we're kind of homebodies, but we've got an active fur child that we both love. And he's back out on the deck playing with the dog and getting things done, small tasks around the garage and the house and stuff. So his activity level has definitely increased from what it's been.
I'm not afraid to actually go out in public even now because I was embarrassed.
It's a goal. He's got a lot of goals, and he's attained some of them already. We had some setbacks, not really due to the surgery, but so we kind of lost the month of July with rehab and some pneumonia and stuff. But man, once he got home and got started on therapy, he's zipping right along. The improvement is phenomenal.
Yeah, I'd like to say, if you're having back problems, make sure that your doctor checks your upper back, because unbelievable to me that we went through all them doctors and all them x-rays and MRIs and brain scans and electrical shock treatments and whatever, all that stuff, and they never ever looked at my upper back. I kind of get the impression that the medical world doesn't realize that the upper back can cause problems the way they do, and a lot of people are missing out. That's the way I'm looking at it now. I mean, how can all these doctors not look at my upper back? At least take a picture of it and say, hey, maybe something's going on up there, but they didn't.
I think also sometimes they don't see beyond the other conditions, the arthritis, the aging. Dr. Kim asked the right questions. And the thing is when you hit a wall and send somebody home with no resources as to where to go next, we were just darn lucky to see Dr. Kim on TV.
Yeah.
And we saw his infomercial about the microsurgery, and we thought, hey, that's cool. And we didn't end up having microsurgery. It was a major posterior
so you gotta
surgery.
right away and watch it, but as soon as he starts doing this, and then it quits, and won't tell you no more. He's not giving away any of his secrets.
Oh, yeah. But we ended up with the traditional surgery, and it was the right thing for us, and it's made an amazing difference.